what medication to take when you're sick.
Dispense medication, drug.
I think a pharmacist fills prescriptions for people that need medicine.
And they push pills on people.
They also work in hospitals and other health care facilities.
They tend to work at Walgreens to make you buy pills.
Hospitals and like retail stores.
So they also evaluate to see whether or not a patient has contraindications.
In the clinic, I'm typically involved in patient medication management. I proactively review labs, look and see for their given disease state. Are we achieving the therapeutic endpoints that we want to with the medication, with the response that we're getting? And we see a significant amount of HIV patients. One of my goals is, are we meeting their needs as far as controlling their virus? Are they on a medication that has long-term tolerability? So kind of controlling their virus, giving them a good quality of life.
So do the same things that any pharmacist will do. I will dispense your prescriptions, I will counsel you on your medications, I will give you immunizations, I will give you recommendations for over-the-counter products. But what makes my job a little more unique is that you may have a condition, or somebody you may know it will have a condition, that the medicines that are readily available, or it's not going to fit the patient's unique medical needs. And that's where I step in, where I'm able to use the knowledge of science, my background in pharmaceutics, and a little bit of creativity to make a custom-made dosage form that's going to fit the patient's medical needs. If the patient has an allergy to lactose, for example, I can make dosage forms that takes these ingredients out, so you still get the benefits of the medication without having problems with these inactives.
Okay, pharmacists in industry have great potential contributions in many different departments. You know, for example, you could work on the technical side, which is what I worked in for 30 years in industry. You could work on the clinical side. You could work in the regulatory side, which is kind of a bridge between technical and clinical. You could get a law degree and work in the patent department. You could work on the business side, where you would become an expert to doctors and other groups as far as drug activity.
So as you can see, the pharmacist in academia is quite busy with affecting improved patient care, improved student learning, and improved application of science to the community at large. I think there is a feeling sometimes that all we do as faculty members is just give lectures and create coursework, but it's far more deep than that. We have to help our students develop their problem-solving skills, their critical thinking skills, performance-based abilities. We have to guide students by advising them on an individual basis as well as an organizational basis. It's important for every faculty member, whether they be a clinical faculty member or a basic science faculty member, to participate in research and scholarship. We have to provide service within the College of Pharmacy, within the university, as well as in national organizations.
I was the first hybrid pharmacist hired at UIC, where I worked in a clinic part of the time and I worked in the pharmacy part of the time. And I was able to use everything I knew from both sides of that practice to help the other side even more. So when I was a clinician in family medicine, I could help with all of the rejects and stuff that we would get from pharmacies, and I'd be able to problem solve and fix it for patients really quickly. And vice versa, I knew how the clinic worked, and so I could work much harder in the pharmacy to help make sure that everything got bridged for the patient and made their experience as seamless as possible. Immunizations, we can be doing diabetic management, we can be doing hypertension management, and that's really where pharmacy is going, because patients need us more now than ever. And we're so accessible and we're so easy to find. We're on almost every corner, and we can do so many things and practice the top of our license and make our patients' lives so much better.
Blood pressure screenings, blood glucose screenings, raising awareness about common disease states such as diabetes and hypertension, talking to local policymakers about healthcare legislation, participating in walks to support various causes.